Good morning to you, good morning to Raul, and to all our audience who tune in every morning. And we begin our briefing today with a pleasant news that for the eighth consecutive day we are not reporting fatalities due to COVID-19 in our country. We currently keep 556 patients admitted in our hospitals, 305 suspects, 244 confirmed, and 7 people are under surveillance. In observation by our primary healthcare system, there are 1,180 people. Yesterday, 2,020 samples were studied in Cuba to detect COVID-19. In the Pedro Curie Institute of Tropical Medicine Laboratory 916, in the Ameijeras Brothers Hospital 290, in the Provincial Center of Havana 282, in Villa Clara's Laboratory 239, in Santiago de Cuba 105, and in the Biotechnology and Genetic Engineering Center 188 samples. As a result of the study of these 2,020 samples, 18 people tested positive for COVID-19 and SARS-CoV-2. Cuba already accumulates 118,488 samples studied, analyzed for the detection of COVID-19, and of them, 2,191 people have tested positive, that is 1.8% of the PCR tests conducted in our country have yielded 2,191 people with COVID-19. Of the 18 cases confirmed yesterday, all are Cuban. Out of them, 17, that is 94.4%, are confirmed case contacts. This is an important high-risk group that we always highlight here. This is the group with the most confirmed cases, and 89.8% of the cases confirmed in Cuba are contacts of a previously confirmed case, totaling 1,931 patients. Yesterday, there was one person whose source of infection was not determined. We now have 64 people whose source has not been identified, 2.9%. We have the same number of people whose source of infection is abroad, 155 people, during the behavior of the pandemic in our country, and this represents 7.2%. Yesterday, the female sex was predominant for 12 of the 18 cases, accumulating 1,088 people in the pandemic in Cuba for 49.6% of the cases. 6 cases were male with 1,103 people, which is 50.4%. 94.4% of the cases confirmed yesterday were asymptomatic. That is, 17 out of the 18 were asymptomatic at the moment of being diagnosed with the disease. This is an important risk group, and our people should be very well aware of it, so as to have the proper protection when one is in a group of people who could be asymptomatic. In the behavior of the pandemic, there are 1,154 asymptomatic cases for 52.7%. By age groups, there were 3 cases diagnosed in the 1 to 19 years of age, The group of 20 to 39 years, 3 cases as well. In the group of 40 to 59 years, 6 cases, as well as in the group of 60 and over, with 6 cases each for 33.3%. Of the 3 cases in the group from 1 to 19 years, one is a 17-year-old girl from Havana, from Central Havana. It's a positive case contact. Another case is an 18-year-old boy, also from Marianao here in Havana, a positive case contact as well. And there is a 15-year-old boy also from Plaza Municipality from Havana, and this is the case whose source of infection is still undetermined. 100% of the cases are from Havana province, and 8 are epidemiologically related with the ICA pharmaceutical laboratory transmission event. These 18 cases are distributed in 10 municipalities, and thus Havana continues in the first place with a positive rate per 100,000 inhabitants over the last 15 days, with 9.27 per 100,000 inhabitants. Matanzas is in second place with 2.36, and Artemisa is in third place with 0.97. And then we reiterate that there are 11 provinces and the special municipality of the Isle of Youth. Despite processing samples every day for more than 15 days, have not diagnosed, have not detected, have not confirmed any case of COVID-19. And I am referring to Granma, Ciego de Ávila, Pinar del Río, Mayabeque, Villa Clara, Cienfuegos, Santi Espíritus, Camagüey, Holguín, Las Tunas, Santiago de Cuba, Guantánamo, and the Isle of Youth. There is the new addition is Ciego de Ávila province. And with this development, the positive incidence rate in Cuba stands at 1.96. Of the 2,191 patients diagnosed with the disease in Cuba, 244 are still admitted as active cases in Cuba. And out of these cases, 241, that is 98.8%, have a stable clinical course. And we always regret the death of 83 people in our country as a result of this disease in our country, for a lethality of 3.78%. Cuba, with this lethality, remains in 17th place among the countries that make up the region of the Americas. The region's lethality is of 5.56%, and there are 10 countries with higher rates than this average rate. Among them, we highlight those countries with the highest, which are Mexico, Canada, Ecuador, Brazil, and the United States, and other countries. And we always mention the 2 patients that were evacuated at the beginning of the pandemic. There were 7 discharges yesterday, and as I explained yesterday, this indicator is not favorable in terms of the positive case versus the discharges. And this is logical, and this pertains to the evolution process of the disease, the 14 days with the disease. For the new 7 discharges, we can say that out of the 2,191 diagnosed patients in Cuba, 1,862 patients have recovered. That is 85.07% of all confirmed cases have recovered and are clinically and epidemiologically discharged. And we report again 3 patients in serious condition that we mentioned yesterday. 2 are admitted in the Salvador Allende Hospital and 1 in the Pedro Curie Institute for Tropical Medicine Hospital. We don't have patients in critical condition today. Until 12 o'clock last night, 185 countries continued reporting COVID-19 cases in the world, totaling an impressive 6,706,002 confirmed cases, with 102,673 additions yesterday. And 2,981 people died in the world yesterday due to COVID-19, accumulating 394,713 deaths for a lethality of 5.89%. The region of the Americas already accumulates 3,206,492 confirmed cases, 44,738 yesterday. The region accounts for 47.82% of the total cases reported in the world. And yesterday, 2,085 people died in our region for a total of 178,273 deaths, and that gives a lethality of 5.56%. And this is information that we had in terms of the national and international situation I had to report today.